Welcome to Breast Cancer Breakthroughs. Breast cancer is the second leading cause of brain metastasis in women after lung cancer. The breast cancer experience will look different for someone who's been diagnosed with brain metastasis compared to someone whose breast cancer has metastasized somewhere else, from their symptoms and their treatment options all the way to their ability to participate in clinical trials. Researchers recognize that people with brain metastases need more progress and that advances are on the way to meet these needs. In this special episode of Breast Cancer Breakthroughs, brought to you in partnership with the American Brain Tumor Association, we speak with neuro-oncologist Dr. Priya Kumtekar about what a diagnosis of brain metastasis means for people with breast cancer and how one can proactively manage their risk of breast cancer brain metastasis. We also spoke with Komen grantee Dr. Jose Pablo Leone about the latest advances in breast cancer brain metastasis and the clinical trials that are aiming to improve outcomes for people who have brain metastases. The risk of developing brain metastasis is not one size fits all for people who have breast cancer. We asked Dr. Kumtekar to tell us about who is at the highest risk of developing brain metastasis.
So when you take breast cancer as a whole, all stages, all grades, it's not a very frequent occurrence. However, because breast cancer occurs so much in the general population, when we do have something like stage 4 breast cancer, we can get brain metastases in anywhere from 20 to 40% of those patients. So for starters, patients with higher stage, so stage 4 metastatic breast cancer, are at highest risk. And then within that, there are certain biologic groups that are at higher risk. So those are patients such as those with HER2 positive breast cancer and patients with triple negative breast cancer. Also, there are some other risk factors that we've seen that can also kind of portend themselves to developing brain metastases a little easier. So again, we've already discussed the metastatic population, but also younger patients, African-American patients, we sometimes see a higher incidence of breast cancer in these patients.
Knowing the signs and symptoms of brain metastasis is an important first step to advocating for yourself if you suspect that something is not right. Dr. Kumtekar explained the signs and symptoms of brain metastasis. And while these symptoms don't always indicate that breast cancer has spread to the brain, it is important to talk to your doctor if these symptoms persist for more than 2 weeks.
So when we think about the symptoms that brain metastases cause, I personally think of these in two sort of buckets. So one is the generalized brain symptoms that sometimes happen when there's higher pressure in the head from the brain mets. So these are symptoms like headache, nausea, vomiting. And then there are specific symptoms that are basically location dependent in the brain. So as you can imagine, if you have a metastasis in the speech center, you can get speech issues. If you have a metastasis in your motor cortex, the motor part of your brain, or the sensory part of your brain, you can get respective symptoms related to that. Or in the walking and coordination part of your brain, your cerebellum, you can get symptoms related to that directly. One other symptom that we can see with brain mets or any sort of irritation to the brain surface or the brain cortex is seizures. And not all seizures look like big, generalized tonic-clonic seizures that you might see in TV or movies. Sometimes you can get smaller seizures like speech arrest in episodes or one side of your body motor seizures in focal motor seizure episodes. So these are all symptoms to look out for when we're thinking about brain mets, or rather when you see any of these symptoms, one should be evaluated for brain metastases.
The site of metastasis can have a substantial impact on a person's experience due to differences in physical symptoms and in treatment options. We asked Dr. Kumtekar to explain how a diagnosis of brain metastasis can impact a person's breast cancer experience.
As this audience probably knows, having brain metastases can impact you in so many ways. I would say I'll start with treatment management as a whole. So when we're talking about brain metastases and we're talking about treatment for it, some of the medical therapy can actually not to get to the brain because of something called the blood-brain barrier. Some of it does, though. There's a lot of newer therapies that do. And so that might make your doctor think about specific medications that are specifically designed for brain metastases. So there can be essentially a change in treatment based on the fact that you have metastases in this location. Another thing from a treatment perspective that might be different for you as a patient with brain metastases might be eligibility for clinical trials. So many of us run or participate in clinical trials around the country with brain metastases or breast cancer as a whole. Some breast cancer studies don't allow for brain metastases, some do. And so these are things that you're going to want to talk to your doctor about. And there are yet additional studies that are designed specifically for brain metastases themselves.
Dr. Kumtekar then explained how patients can proactively manage the risk of developing brain metastasis.
So the key in diagnosing brain metastases is being on the lookout for it. So as it stands right now, there's no screening standards for brain metastases, even in patients with some of those risk factors that we spoke about, like stage 4, metastatic disease, HER2 positive, triple negative. There really aren't screening parameters for that as of now. I think that that's also an evolving spectrum and hopefully an evolving science. So right now, it's really important, both as patients and doctors, to be open to that if those symptoms arise, or to make sure that we check for brain metastases should those symptoms arise. That being said, because there is a risk for brain metastases, what I would really encourage you to do is, if you have neurologic symptoms that arise, make sure you tell your doctor, make sure you tell your healthcare professional. They can help guide you through that. And if needed, order an MRI brain to make sure that you don't have brain metastases, or to see if you do, catch it ideally as early as possible so that you together as a team can do something about it.
For more information about brain metastasis, check out the resources from the American Brain Tumor Association that we linked below. Overall, Dr. Kumtekar is optimistic about the progress being made in treating breast cancer brain metastasis.
We have a long way to go in breast cancer brain metastases, right? We won't stop till we have a cure. But that being said, we should celebrate the wins. And over the past couple years, we've had a couple wins with some drugs that we now know help both brain and body when we have metastatic breast cancer. Particularly in the HER2 setting, we're seeing a lot of advancements there. And so I'm heartened to see those movements in the course of my career, and I'm excited to see even more. We're also making a lot of progress in terms of diagnostics, so both in brain imaging as well as looking at cerebrospinal fluid that we talked about, the same fluid that's around the brain and spine. There are new developments happening with diagnostics there where we can capture that fluid and look at a lot of the same things we can in the bloodstream. So things like circulating tumor cells, or even DNA or genetic material that tumor shed, so we can follow things more closely in the central nervous system. So I'm excited to see some of these advancements take place. It's been great to see them, but we all know we have more work to do, but we're up for the task.
As Dr. Kumtekar mentioned, significant progress has been made in treating breast cancer brain metastasis. We asked Dr. Leone to tell us more about how treatment of brain metastasis has evolved over time and how it's treated today.
The treatment has changed quite dramatically over time. Initially, patients with brain metastasis were treated either with whole brain radiation or, in very few circumstances, surgery. And the systemic treatment options that we had were quite limited. And today, the treatment consists of 3 main areas, which are surgery, radiation, and systemic therapies. And within those areas, the treatments have changed quite a bit. So for radiation, we now use stereotactic radiosurgery or stereotactic radiation therapy, which is more delimited to the brain. And for systemic therapies, we have now much more effective regimens including regimens that have specific indications for brain metastases, which we didn't have before.
Dr. Leone explained the different factors that doctors consider when treating a person who has brain metastasis.
There are several clinical factors that we think about. One is the type of breast cancer that the patient has, whether it's estrogen positive or HER2 positive or triple negative. Those can play a role in deciding the type of treatment that the patient may benefit the most of. And other factors include the number of brain metastases, the speed that the brain metastases have grown, the number of metastases outside of the brain, and whether those are also growing at the time that the metastases in the brain are appearing versus whether those are either absent or stable.
Next, we asked Dr. Leone to tell us about some of the biggest unmet needs for people with brain metastasis.
Some of the biggest challenges that we still have are the issue of brain metastasis from triple negative breast cancer, where we have not had as much improvement over time as we have seen in other subtypes of this disease. Also, the fact that breast cancer is one of the most common causes for leptomeningeal disease or leptomeningeal metastasis. And this is a type of metastatic breast cancer that is very difficult to treat as well. Some of the treatments that we use for patients with brain metastases, for example, whole brain radiation therapy, can lead to what we call cognitive function changes, which is the difficulty to think about certain things and the ability to think in multiple ways at the same time. Also, sometimes we think about patients who may want to participate in clinical trials, and because they have brain metastases or because they have leptomeningeal disease, some clinical trials will exclude those patients, therefore not allowing them the possibility to participate. And those are some of the areas that I think we need to make more progress.
Dr. Leone mentioned the challenges of treating leptomeningeal metastasis, which is a type of central nervous system metastasis that impacts the fluid and tissue surrounding the brain and spinal cord. Breast cancer is the leading cause of leptomeningeal metastasis. If you want to learn more, check out our video of Dr. Kumtekar explaining leptomeningeal metastasis that we linked below. Dr. Leone then told us about some of the most exciting research advances for breast cancer brain metastasis.
One of the most recent presentations have been the data from a clinical trial called Destiny Breast 12, which is a trial that evaluated a medication called Enhertu or trastuzumab deruxtecan for patients with brain metastases that were either stable or progressing. And that clinical trial has shown a very high efficacy of that drug for patients with brain metastases. Prior to the reporting of this study, there were a few smaller prospective and retrospective studies that have shown efficacy of this drug in brain metastases. But the larger clinical trials that led to the approval of Enhertu in clinical practice had excluded many patients with active brain metastases. And there was still the question among the community as to whether this drug would be a helpful option for patients with brain metastases, particularly brain metastases that were active or growing at the time of starting treatment. And in fact, this study shows that indeed it is, and the efficacy in the brain was very similar to the efficacy outside of the brain.
In general, Dr. Leone was excited about the potential antibody-drug conjugates like Enhertu will bring to patients with brain metastasis.
There are other antibody-drug conjugates that are being studied and many that are in the pipeline. It's remarkable how the field of antibody-drug conjugates has evolved over time and has really become front and center on many of the research efforts. And so there is a question as to whether different targets may also be effective for the treatment of patients, both with HER2 positive and especially with HER2 negative breast cancer, as well as treatments that use, or antibody drug conjugates that use different payloads, as we call them, which is the active drug, the active chemotherapy agent that will go to try to kill the cancer cells. And so we certainly look forward to the studies that are being done with antibody-drug conjugates beyond trastuzumab deruxtecan or Enhertu to see what other options may be helpful for patients as well.
Dr. Leone also walked us through some exciting clinical trials aiming to improve outcomes for breast cancer patients with brain metastasis.
We have several studies that are open currently that are looking at different questions that I think are very important. And this includes many areas within brain metastasis. One, for example, is a question about screening for brain metastasis. And there's a clinical trial to try to assess the utility of screening patients to see if they have brain metastases when we're doing our treatments for breast cancer. Another study is looking at an option of dedicated radiation therapy, but to more than 5 lesions in the brain, which is an area where historically with multiple lesions in the brain, we have thought about doing whole brain radiation. And this clinical trial is trying to assess whether doing dedicated radiation, even if the number of lesions is higher than 5, could be a safe option for patients with brain metastases that are ongoing. And we have also a trial that we're excited about testing tucatinib, which is one of the recent developments in patients with brain metastases, but testing tucatinib to see if we can add it to the existing treatment that a patient is receiving and help prevent progression in the brain for those patients.
On behalf of Susan G. Komen and the American Brain Tumor Association, thank you so much for watching. We hope you've come away with more awareness of the signs of brain metastasis and some information on what you can do to advocate for yourself if you notice any of these signs. We hope that these recent and upcoming research advances provide hope that progress is being made in treating brain metastasis. Don't forget to sign up for reminders for breast cancer breakthroughs. We've linked the homepage below. And finally, if you enjoyed today's episode, please take 2 minutes to fill out our short survey that we linked in the description.